Hello everybody, welcome to another edition of our Community Access. This week, Terry will visit with a brand new doctor in Oxford, all today on our Community Access. Welcome back. We have a brand new doctor in Oxford, Janelle-Mackowiak. Janelle is certified functional medicine. With this story is our reporter, Terry Stiles. Terry?
Hi everybody, I'm Terry Stiles. Welcome to our Community Access. And I want you to welcome Dr. Janelle-Mackowiak to our studio. We are in the studio today, and I've met Janelle a couple times through Zoom with the Chamber of Commerce meetings that we have, those Coffee Connects that we really want to see everybody at. And I was so intrigued by Janelle's titles, Dr. Janelle, but I want you to tell me what your studies have been and the process that you've gone through to become a practitioner. And it's so interesting to me that this is definitely a field that I'm interested in anyhow. And it's holistic wellness, basically, right?
Yes, exactly. Okay. And I appreciate,
I'm so excited.
I appreciate that, Terry. So I am a doctor of naturopathic medicine. I also am a chiropractor, and I have my postdoctorate in functional medicine. And I know most people don't know what many of those things mean. Basically, I'm trained just as a primary care physician, except I do everything from a holistic standpoint. So I treat and support patients, really support them using herbs, different tinctures, homeopathic remedies.
Which goes along with the chiropractics, right? It's getting your body in alignment.
Right, it goes all, it really melds well together if someone is looking for a more natural way of taking care of their health.
Sure.
So I went through medical school and residency training and really do internal medicine, like I said, just like your primary care physician, except with the focus being holistic. So I don't prescribe prescription drugs. And I really love it because I get to see the progress my patients have with what they come to me to, all the different ailments that they do have.
And so you also work, so say there's a cancer patient and they're working through a chemotherapy regime. Yeah. You also work with them holistically and homeopathically, correct?
Correct.
Love that.
So homeopathy is one of the tools in my tool bag. It is its own area of study.
Which is what? So for people that aren't familiar with
homeopathy? So homeopathy is an energy medicine.
I love that.
And it's in really very small doses that really support what that type of condition is for. You choose a remedy based on different aspects of that person. It's really interesting. Wow. So that again, that's a whole nother area that we could get into.
I'm so curious about all of that. I just think it's fascinating. I was raised with a DO, Doctor of Osteopathic Medicine. So I firmly believe, and he was always very helpful to anything that was going on with us. And I don't mean to make this personal, but for 2 years I went through having hives all over the place.
Oh my.
And it was basically cured homeopathically. Not cured, but I know how to get that under control.
Absolutely.
You go through I went through regular routines, doctors, and 32 different tests. And they couldn't figure out what it was until energy came into play.
It's really interesting that you mentioned that, because a lot of patients that come to see me, they say, my doctor can't find anything wrong with me. Or they've been, my patients have been to 10, 15 different doctors.
Right, and that's so common.
It is, and they just don't feel well. And really with naturopathic medicine, we're trying to really think outside of the box and look for those underlying causes. So part of those naturopathic principles that we do follow is we make sure that the support that we give is not only safe but effective. So I know everyone out there, you look up on Google what's wrong with me, and you can spend hundreds, thousands of dollars in all these different things, and nothing seems to work. So that's why I really recommend go to a professional. That's why you take, if you're not a mechanic, you take your car to a mechanic if it needs to be fixed. The same thing is true for holistic medicine.
Somebody once said to me that your spine is basically, speaking of cars, the engine of your body. And so chiropractically speaking, when that's not in alignment, everything else can get thrown out of whack, right? So I see how you're interested, or you were interested in studying all those realms to bring an entire body into alignment, and that's how people stay healthy or get healthy.
It's part of it, absolutely. So we do our spinal cord has nerves coming out, and those nerves go to our organs and into our muscles and into different tissues and can control different things. So if you are out of alignment, or you have a quote, let's say pinched nerve, there can be not only pain involved, but that there can be a dysfunction or a problem with an organ. It can whether it be an earache, gut issues, hormone issues, etc.
And so I know that you practice in many different communities, but in our community you're practicing out of Willow's Edge.
It's right on the corner of Burdick and M24. 2B South Washington is the address.
Say somebody has been through all the gamut and they're still searching to figure out what's wrong. They give you a call. What's the process that they'll go through?
Oh, great question, Terry. So I do offer a free 15-minute discovery call. Again, most people aren't really familiar with a naturopathic physician, and I want to make sure that they're comfortable with me, and then it's a good fit as well. So I schedule that. You would call my office and schedule a 15-minute discovery call. And that's when I would explain to you the process of our first visit, the initial consultation, which does last between an hour and an hour and a half. So I do spend a lot of time with my patients. I get very invested in their care because I know if you don't have your health, you don't have anything. And we really take that for granted.
We do.
Much of the time. And I know my goal for my patients is, I want you to feel good. I want you to be able to do the things that you want that you want to do.
Sure, and not waste their time or yours in getting to the end of that process or the goal of that process.
Absolutely.
Right?
And if anyone were to ever come to me and I don't think I could help them, I'm going to let them know.
Hi, welcome back. I'm Terry Stiles, and with me is Dr. Janelle Mackowiak, and man, you have some interesting stuff to talk about. We were wrapping up talking about a first visit to you, or an assessment visit. What would be a really good reason to give you a call first thing?
Oh, yes. So patients come to see me just like they would go to see their primary care physician. I can support patients with autoimmune disease,
Oh, interesting.
sleep issues, anxiety, depression,
Wow.
gut issues, hormone imbalances, just to name a few, headaches, migraines, etc., etc. So really,
fabulous.
anything you would see your primary care physician for, you can see a naturopathic physician for.
And so naturopathically,
Yes.
naturopathic wellness is the term that you use. What does that mean?
So naturopathic wellness really talks about kind of our tenets, or the naturopathic tenets, and as I mentioned before, we want to make sure that what we're providing to our patients is very safe and effective. We want to get to the root cause, or find out why something is happening. So, for example, if somebody has acid reflux or GERD, rather than giving an acid blocker, my question is why?
Where's it coming from?
Where is it coming from? Is it food sensitivities? Is it an ulcer? Is it not enough stomach acid? Is it due to stress? Is it due to, could there possibly be, bacteria, parasites, etc. within the gastrointestinal system, or in your gut, that could be causing the issue. So rather than just slapping that Band-Aid on it, I'm gonna get to the bottom of it and find out what that root cause is. As a primary care type physician, doctor, that what's different than us is that I'm not going to send you out to a gastroenterologist and a cardiologist and a pulmonologist.
So nice.
We really take into consideration the whole body. So you may come to me with gut issues, but we're going to talk about your energy and your sleep
and your lifestyle,
and your
health and wellness.
Exactly.
Yeah, okay.
Exactly.
Or how to make your lifestyle healthier.
That's what we do. So
drinking water is one of them.
Yes, drinking water is one of them for sure. But that's something that I talk with my patients about. We talk about nutrition. We talk about lifestyle changes. It's not just me giving a bunch of supplements to you. It's about lifestyle changes. And I'm going to be there for my patients for not only accountability.
I was just going to say that.
But to make sure that what we're doing is working, that we're progressing forward and not backward.
Right.
Like I said, I invest a lot of time and care in my patients because I know they're investing a lot in me.
And that's something that I know that we've all been lacking. Gradually over the years, we are going to one specialist after the other, and you sit there and wait for 2 or 3 hours to get to see them, and 15 minutes you're out again. I had a physician tell me one time, he was a child care specialist, that one grandmother was worth 2 child care specialists, because they were homeopathic, because they treated the whole person and not just slapping medication at them. And really, we've grown away from that. I can remember when I was a little girl, we did just go to one doctor, and he took care of the whole family and took care of everything. And you develop a rapport that way, rather than just being treated as a patient. And I realize how important that is. And it's really nice to know that you're there, and that's part of your practice.
It is. It's very important.
Essential part of your practice.
It is. I care a lot about my patients, and we end up developing a really, really close bond.
So really, I would go in and you would discuss lifestyle and everything else. And people want to be heard in that respect, because they can't be their own diagnostician. They need help with that. Granted, what they have to tell you helps them become part of that diagnostic process, but it's difficult to be a diagnostician to begin with.
Absolutely.
Without treating the whole person.
Absolutely.
Right?
So it's kind of like putting together a puzzle. I'll explain a lot that I get certain pieces, and that's why I do a lot of advanced type testing. So I want to know the physiology of the body. It helps me empower you as my patient, really learn about what is going on with inside their body, so that way you know how to be an advocate for your health. So that's that's another part of the naturopathic principles that doctor as teacher. My job is to teach you ways to be healthy, teach you about your body, teaching you about the physiology and what's going on, which is really important. And that's where I get to base my support. I get to see what's going on inside by the testing that I order for you, and then I get to explain it all to you, what everything means, what all the different markers stand for.
So you're working as a team then?
Yes, exactly. And then I come up with a care plan for you and let you know, like, this is what it's going to look like.
Wow, that's great. So you're in it for the long haul.
Yes.
You're not just in it to get them out of your office.
It's not a one and done.
Right. So what if somebody has a pre-existing condition rather than you trying to diagnose it, and say they've been on, say it's a heart patient or somebody that's had kidney issues and they've been on medication forever and ever. Now they also want to approach it homeopathically. How does that work for you? How do you do you work with their physician as well?
Yes, so I think integrative medicine is definitely where it's at. I think that utilizing not only natural means, but also incorporating, if we need to, prescription-based medications. Now, I personally...
A multidisciplinary approach to... Okay, right.
Exactly, exactly. Now, I can't write a prescription in the state of Michigan or take you off that type of prescription. I can only give you supplements, tinctures...
To enhance that.
To help enhance that. But I have been very successful for those patients wishing to get off of prescription medications, being able to talk with their doctors and helping guide them as they get healthier. Their doctor sees them get healthier. They've been able to reduce, if not completely, get off of medications.
And they're very. Now I'm seeing doctors are very open-minded to that multidisciplinary approach.
More and more,
right.
More and more, for sure.
They should come around. Anyhow, more discussion on how you can get a hold of Dr. Janelle when we come back.
There's a hidden problem going on right now in our community. This past year has created tremendous financial stress on families. Many are having to make sacrifices they've never had to face before. Some are even going hungry. But there's also something amazing going on behind the scenes. Samaritan House, the Manna Food Pantry, K-Pac's Kitchen, the Oxford Orion Fish Food Pantry, just to name a few. All of these organizations are powered by an army of volunteers, people who give of their time and their money and other resources so that their neighbors, our area families, don't go hungry. And Four County Community Foundation has been there, behind the scenes, granting these organizations money for equipment and supplies to make this happen for many years. But we realize there's more need than ever before. So today, we're announcing a new fund, Feeding Families Forever. This fund is designed to create an everlasting endowment so that organizations in our community have the resources they need to keep doing their incredible work. One hungry mouth, one meal at a time. Now we're asking for your help. If you're ready to step up and help support us and see that no one ever goes hungry in our area, just follow the link provided and let's feed families forever.
For food security. for our community.
For County.
For County Community Foundation. For us, for our community, for County.
Welcome back. I'm Terry Stiles, and I'm still with Dr. Janelle Mackowiak, and what an interesting conversation we've had.
Thank you.
One thing, and again, I'm not making it about me, but I know that I've had a lot of experience with diabetics, and I know that if some of them would change their lifestyle, maybe they may not be able, or may not be dependent on insulin. So can you work with people like that?
Absolutely. I absolutely love working with patients that are diabetic. I love working with all types of patients. But for example, if you are someone that does suffer with diabetes, there is definitely a lot of things that we can do together to lessen the burden of prescription medication and the insulin. But what I find is the issue is that oftentimes patients just simply aren't given the tools to be able to do it. They're not able to get the support. It's kind of like saying to a chef, make a cake and not providing them any flour.
Oh, sure, that makes sense. Yeah. So you can guide them through that for the long term.
Yep.
And maybe hopefully help get them off of that insulin dependency.
Yes.
I know that weight has a lot to do with that. And that's a huge issue for all of us. And especially the last year, we've been so sedate.
Absolutely, absolutely. So just to reiterate what you were saying, Terry, that yes, I've been successful in helping many patients reverse their diabetes to really normalize their A1C levels, their insulin levels, so they're not dependent on those medications like they once were.
Also, issues are cholesterol. I mean, I guess I'm talking about aging issues because I can relate. But then there's cholesterol issues that I think also can be reversed with the proper tools.
Absolutely. I think cholesterol is some of the easiest things we can do together to reverse.
Gosh,
absolutely.
You give me so much hope for people that, I mean, it's been a year of, I think, all of us assessing our health because of the COVID-19, and I think a lot of us are going through that. There's a fear factor to that, and if we're healthy enough, are we going to survive the 19 if we get it, and blah, blah, blah. It makes, I think, all of us reassess our lifestyle, and especially since we have been sitting around for the last year kind of shut in. It's encouraging to hear you say these things, that you can work with them and not just slam some medications at you and say, out the door, I'll see you in 2 weeks. And then there's people that are going through, say they're going through cancer treatments that I know that they want the holistic approach along with whatever their oncologist is giving them, or whatever the treatment that they're going through. And so it's nice to know you're there at the Willow Center.
Willow's Edge.
Willow's Edge. So how do people get in touch with you there?
Oh, well, you would get in touch with me through my clinic, which is Cherry Blossom Natural Wellness. You can call. The number is 248-274-6516, or you can always email me, and that's Dr. Janelle Mackowiak @gmail.com.
Now, if they go see you, are you also set up there for the chiropractics, or is that part of your whole entire
So it's
regime?
really interesting. It's really interesting that you asked that. So I'm not a chiropractor anymore in the traditional sense. So I actually refer out for physical.
But you know well enough
yes,
to
I
know
know how
what they need.
I know.
I
I know how important it is for the body to be in alignment, it got me to where I am today. So I do understand that, but I simply choose not to do physical medicine anymore. My heart is really in internal medicine, and I feel that that's where I can really support and benefit my patients most.
And aren't we all better at what we love to do?
Yeah,
I think
absolutely.
the best advice I ever got was forget about money, do what you love to do.
Yes.
Which I'm fortunate enough to be here, and I love it, and it's not a job. Just like I'm sure it's not, although I know you run all over the place, you have offices in different directions, I don't know how you do it, but obviously that speaks for your lifestyle, that you have the energy to keep up with yourself and your offices and your patients. And
absolutely. So I'm an autoimmune patient, so I know what I do works. Knock on wood, I rarely get sick or have a flare of my autoimmune condition, and I feel pretty good for the most part. And I mean, when you live and breathe what you tell your patients, it's really a testament.
Sure it is. Well, I so appreciate getting to know you and getting to know what you do. It's intrigued me for a while, and we tried several times to get together to do this, and I'm just so excited that you were able to take the time and do it, and I really want the community to know you and to seek you out, because just sitting next to Janelle is great energy. So I'm encouraging everybody, if you're not in a position that you need assistance, just say hi. I'm telling you, it's really great to get to know you, and anytime you want to come back, I'd love to hear more. And especially if you're running into new things and new exciting treatments that you want to tell me about, please.
Absolutely. Terry, I love that. I'm grateful for that, and I appreciate it so much. Thank you for having me here today.
Thank you, and thank you for joining us at OCTV.
There you go. So for our reporter and editor, Terry Stiles, and technical director, Dan Zweiss, I am Bill Service, and we hope to see you again on our Community Access.